welcome to the OC Shrinks. We are a mental health networking group that believes the best way to uplift professionals in the field is to provide a space for connection, collaboration, and community. And we are excited for this today's event, Increasing Community Mental Health Competency, in partnership with Crisis Intervention Team, CIT, at NAMI OC. Topics covered will include crisis intervention training and the utilization of peer support services. So thank you all for being here. And Aisha, who am I handing it over to? Or Shivani? Okay, right, Aisha.
Thank you. Thank you so much for that. So hello, everyone. My name is Aisha Khan. I am from NAMI Orange County. I am joined by my counterpart, Shivani Parmar. And today, thank you so much for joining us. We will be discussing increasing community mental health competency. And the two scopes that we will be discussing today is through CIT, which stands for Crisis Intervention Training, and then the utilization of peer support, both of which have the common thread of lived experience. And we believe at NAMI that lived experience is a key role in a person's journey, mental health journey, and journey to recovery. So with that being said, I will allow Shivani to introduce herself.
Thank you, Aisha. So my name is Shivani Parmar. I am a program coordinator for NAMI Orange County with a specialty in focusing on crisis intervention training. It's been quite an interesting journey because I never really thought I'd be in mental health, but I always knew I wanted to teach. And so here I am teaching crisis intervention. So it's kind of amazing. And we'll go ahead and get started here.
All righty. Really quickly, for those of us that maybe aren't as familiar with NAMI, we are a 501c3 nonprofit organization. We have been in Orange County for over 40 years. We were founded in 1980, and we are an affiliate of both NAMI California and NAMI National. So we are the local Orange County affiliate here, enacting change right in our backyard. We offer support, education, and advocacy to really anyone affected by mental health conditions. So whether they are a family member or a peer themselves, you will hear the word peer frequently throughout this conversation. Our definition of a peer is just a person who lives with a mental health condition. So, we provide education, support, advocacy, resources. All of our programs are going to be delivered at no cost. So that means that everything that we do to the individual that's receiving the services will be free, which is, really, really great and breaks down that barrier. All right, Shivani, I'm ready for the next slide. Thank you.
All righty. And so really, we're in NAMI Orange County. Our mission is to provide emotional support, education, and resources for those affected by mental illness. We know we're preaching to the choir here when we say, we are looking to get that extra step and collaborate with an entire community so that we can have a life of quality and dignity, one without discrimination for anyone who's affected by mental illness. And I'm sure, these statistics are ones that, while they may be shocking to those in the community not familiar with mental illness, we're sure that you are all quite aware of these statistics and how important it is to really, spread awareness and really focus on education around mental health illness in our communities.
All right, so now let's look at mental health competency. So the whole conversation that we're here for is how do we increase mental health competency within Orange County? So what we're looking at is kind of a model approach, right? So we're looking at organization, mission and strategy. We're looking at expectations and success criteria. We're looking at integration with all people and processes. And then we're also looking at the utilization of common language. So we're going to kind of break that down into bite-sized chunks for you all throughout the course of today. And we're going to see how we can create a model of care and a network of care within Orange County that really provides individuals with mental health conditions the opportunity to thrive and do well. So first off, an amazing way to do this is by increasing partnerships and collaborative efforts countywide. We're going to be getting into this in just a little bit, but NAMI Orange County actually provides CIT training with Western Youth Services, who is our partner organization. And through that collaboration, really we've been able to, the meeting of the minds has been so important to creating and a really emboldened, robust crisis intervention training for our first responders. So kind of having organizations that we can depend on and rely on and kind of share best practices. And both of us are coming from our respective areas of expertise to really see something through. So creating those partnerships are key. Then we have clearly defining goals and projected community outcomes. So within this collaboration, this collaborative effort that we have with Western Youth Services, we really want to be on the same page. We want to make sure that what is the ultimate goal? What is the public health goal that we are achieving? And what is the public health goal that we are striving for? So in this case, specifically with CIT, we're looking at, reducing recidivism. We're looking at, just helping others or helping those in crisis be less traumatized during their moment of crisis. And then through the peer support role, we're looking at really just offering a person an enhanced level of understanding. And that enters into suicide reduction and those conversations. So having clearly defined goals and outcomes is key. It really is the core and the center of all the efforts. Now we move into creating steering committees. And this is something I'm very excited to share that Western Youth Services and NAMI have been able to do quite successfully recently with crisis intervention training. So not only do we have this beautiful partnership between us, our two organizations, but we've pulled in esteemed community members and experts in their respective fields. So this includes hospitals, this includes majors and sergeants from police departments. This includes really county individuals who are buying into the overall efforts that we want to see to enact change in Orange County. And through these monthly steering committee meetings, we're then able to really have a very collaborative, uniform approach to enacting change. And with competency in general, this really helps assure everyone is on the same page. And jumping down a little before we go to identifying mental health champions, making sure that everyone on the same page really relies upon common language. Common language is essentially what we can all agree on. It is words that we use often, and they help us identify what our goals are moving forward. So here, the two phrases that you are going to be hearing during this training is peer support and crisis intervention training, or CIT. And these two pieces of common language, so to speak, allow us to define what we're working toward and define what we want to see happen. So lastly, identifying mental health champions. This really is going to be people like police, sergeants, police chiefs, community benefit directors at hospitals, people who are higher up in their organizations who can allow the message to trickle down throughout their respective organizations.
Yeah.
All right, we're next.
And then also, one thing that I always like to input here is in a lot of our crisis intervention trainings, we also have mental health champions who are affected with either a diagnosis themselves or have a loved one with a diagnosis. And so really, we love to have those with lived experience come in and teach some of our classes. Just last night, we had a 1 hour long training where we had two peers really discuss some of their interactions with those first responders and healthcare professionals, and how those experiences when they've been in crisis have impacted them, throughout their life with a diagnosis. So just amazing work being done all around.
Absolutely.
Oh, beautiful. Okay. Next, we want to cover our peer support services. So another quick little statistic that I'm sure you're all quite aware of is that the average delay between initial symptom onset and professional treatment is on average about 11 years. And we all know, therapy, self-care, and medication have made recovery a reality for most people experiencing mental illness. However, what can be difficult for our peers is initially seeking that initial medication or therapy. And peer support is one of those options that we really, really emphasize, because it can truly be a stepping stone into professional treatment. And, peer mentors really do have that ability to share their lived experience, because there is that unique dynamic of both having a lived experience or having a loved one with a lived experience. And it creates for this, beautiful collaborative environment in which sharing each other's stories and journeys is encouraged, right? And generally, with our peer support services, it's seen, once that someone who's been in your shoes before has taken the step towards professional treatment, that person may feel less stigma, or may feel themselves ready to take that next step into seeking professional treatment themselves as well.
All right, so now we're going to kind of break down after Shivani just gave the overview of what peer support is. We're going to kind of look into what exactly NAMI specifically offers for peer support. So we have quite a few programs. We kind of cherry picked the more the newer ones for this today. So we have a program called Peer Connector, and we have a program called Face to Face. Both are very, very similar in implementation and in purpose. So Peer Connector and Face to Face essentially are a 12-week and 6-week respectively long programs where a peer will get paired with a trained mentor. This mentor lives with mental illness and has lived experience and is living well with their diagnosis. So over these interactions, Peer Connector is over the phone. Face-to-face is typically over Zoom, just like we're all doing right here. And it really is an opportunity for community members and individuals who just want someone to talk with, to get just that. They get support. There's shared experiences where they really get to learn from one another. And then of course there are resources given. So we've actually had quite a few success stories, and I'll share a quick one with you all. In our Peer Connector program, this was a few years ago, we had a peer who was experiencing homelessness, and they had a dog who they were very, very close with. And unfortunately, one day, due to a mental health crisis, they had to, the ambulance was called and they were taken to a hospital, and their pup was just completely nowhere to be found. Once the individual, the peer, was released from the hospital, they were devastated, and they couldn't find the dog. And all the while they had our Peer Connector on the phone with them. And so the Peer Connector took it upon themselves to call around, and lo and behold, after calling a few of the shelters, animal shelters, they were able to reunite the individual and their dog. So just really, just those kinds of things can't really be quantified, right? It's about enhancing a person's quality of life, and that's what peer support aims to do. So that's peer connector and face to face. Another area of peer support that we have that is kind of, dare I say, revolutionary in Orange County is NAMI Connects. And NAMI Connects currently takes place in 2 hospitals. So it is at the Be Well Orange campus. It is also at Hoag Hospital, Newport Beach, in the emergency department. In both of these hospitals, we have a trained mentor who is trained both by NAMI and by the respective hospital. And they see patients. They see patients not only, in the waiting room, but they see patients in their actual rooms. So if a person's in the emergency department, our mentor will go in and have a conversation with these individuals. And this kind of was birthed out of the idea that, when a person is on a 5150, and when they initially go to an emergency department, to an emergency room, a lot of the time nurses are very busy. A lot of the time hospital staff, rightfully, they are very busy, especially with COVID, right? Especially with the past year that we've had. So what we've been able to provide is a person who can be there, who can listen, who is dedicated solely to that purpose of listening and providing comfort, providing resources while the nurses care for the medical care, or while the nurses focus on the medical care of their patients. We can come in and we can just make the experience a little bit softer, and we deliver it with the punch of, what, a lot of us have been here too. We understand how stressful it can be. We understand how scary it can be. And we're here for the person. Something really interesting with the NAMI Connects, or really exciting, I should say, with NAMI Connects, is that we also do follow-up calls. So not only are we initially speaking with the patient and their family members, if the family members agree, but we're also conducting just follow-up appointments, making sure that they're doing okay, checking in. If they need any resources, we're going to be right there for them. We're going to be delivering those resources to them. And it's a great way to just provide a little bit of an extra touch in what is typically a very scary setting for people with a mental health condition.
Absolutely. And next, so another way in which we really have that peer support is through our peer-led support groups for any of those who are either affected by a mental health condition, and for family members who may have a loved one with a diagnosis as well. So we have 3 support groups at the moment, and that is one for family members, one for our peers, and one for first responders, which was developed in conjunction with our crisis intervention training package. And so these support groups have really just been such an amazing part of our NAMI offerings. We have support groups that have been led for over 18 years. Our board president, Steve Pittman, is in on those meetings as well. And I've luckily, through the opportunity of being able to lead some of these crisis intervention trainings, have been able to meet some of these support group members, and the things that they tell me about finding support and finding just a community who understands, the struggles and wants and needs of someone who is really just like them is really invaluable, and an invaluable experience for some of our peers, and for those family members who live with our peers with a diagnosis. And so those support groups can just have such an insight from the challenges and even successes of others who are facing similar circumstances that they are. And then lastly, we also have the Warm Line. The OC Warm Line is our free and confidential 24 hours a day, 7 days a week telephone service, where we provide emotional support and resources to Orange County residents. And that's not just for peers, right? We have family members who call in as well, looking to get support for their family members who currently have a diagnosis. And they also have amazing stories, just being able to work the phones for a little while and hear some of those initial tales before connecting them to one of our specially trained crisis counselors, you really get to hear such a variety of stories and hear the backgrounds of so many interesting people who are looking for those resources and support within the Orange County area. And it really makes you come to understand the need that we have for those resources and that support for those who may be suffering a mental health condition, or for their families as well, who, you know, are overwhelmed by the process of their loved ones going through a mental health crisis. So when to consider peer support. Not quite a friend, not quite a professional. Peer support can provide connection through lived experience. And of course, we want to make sure that, you know, your professional experience is absolutely invaluable. The help that someone can receive through therapy and medication is of the utmost importance, and we always try to maintain that. However, we do want to maintain that peer support can just offer a different dynamic, right, for those who are looking for a different kind of care. And some of those, you may have a client who is, you know, looking for a social connection, right? And that's something that we've been seeing pretty heavily through this past year with the pandemic. So many people have become socially isolated. And so really when they're calling into the warm line, when they're calling in for peer connector or logging onto Zoom for face-to-face, really what they're looking for is just someone to talk to and someone at the other end of the line. And sometimes, you know, they want someone who they don't see as that healthcare professional or their doctor, quote unquote. They want someone who they can consider a peer or a friend in the community. You may also have a client who calls frequently in between sessions, who's just looking to talk. And of course, I'm sure, you know, you all are readily available for all of your clients at any time. But sometimes, you know, when we need to practice our own self-care and establish boundaries, it may be a wonderful idea to direct them to peer support options in which they can have someone that they can, you know, call if they're not, if they're just looking to talk or just connect or bond with someone. And then you may also have a client who, you know, really they just want to hear from others who've been in their own shoes, right? We are all the subject matter experts of our own story. And so while, you know, we do have professional and academic experience, sometimes our clients are looking for a connection from someone who has been in the same place that they have or has the same experiences they have, experiences that, you know, we ourselves may not have. And so just that lived experience does provide a unique opportunity for, you know, members of our community to connect and really get help in kind of a unique way through this amazing dynamic.
Absolutely. And I would like to reiterate a few important key points that Shivani mentioned. So first off, like we said, nothing can replace traditional therapy, traditional professional treatment. There's no replacement for that. Peer support simply is kind of an enhancement, an add-on. And we are also not discounting that there are many of us who have our own stories. I know myself, I entered the mental health field because I myself do have a diagnosis. And that's something, you know, that as professionals and as you all, you know, if you are an MFT, if you're a PsyD, or if you're an LCSW, you know, with your caseload, with your clients, you may also have your own story. The only difficulty is with that is that there's oftentimes a limit to how much you're able to share about yourself. And for your own protection, we want to make sure that you are, you know, you're not sharing too much to kind of put yourself at risk. So the happy medium would be that peer support piece where someone really can just relax into a conversation and talk about the nitty-gritty of their mental health experience. But in no way are we saying that at all that this is a substitute for professional treatment, because it is not. All right, thank you, Shivani.
Yeah, absolutely.
Okay, and now, so switching gears a little bit, we're going to be talking about the other step to this whole increase in competency, which is supporting the community through systemic action, and that is crisis intervention training. So crisis intervention training was actually started by a NAMI in Tennessee, and it is now known as the Memphis model. Quickly, that model spread throughout the entire country. And actually in Orange County, we had quite a few agencies adopt CIT, not necessarily the Memphis model, I'm unsure of, but we've had quite a few agencies adopt the crisis intervention training for police officers, dispatchers, first responders in general. Just this past year, the collaboration between NAMI Orange County and Western Youth, we also entered into that space. And what we decided to do was align both of our missions and say, you know what, the lived experience is a key component that can really drive home the message of empathy for our first responders who really may not themselves have the lived experience or personal understanding of life with a diagnosis. So in 2020, we collaborated and we birthed a really amazing and robust CIT program, which we're about to jump a little bit more into. Awesome. So before we jump into everything that we've been doing, let's just kind of generally overview the goals of CIT itself. We went over the goals of peer support. We went over why it's utilized and when to best utilize it. So let's do the same for CIT. So I'm just going to kind of read off of these points for you, and then I'll offer some personal anecdotes. So improve safety during law enforcement encounters with people experiencing a mental health crisis. This is going to be key. We want to assure that people on both sides of the equation are safe. A lot of the time what is it called? I'm completely blanking on the name, but there are certain de-escalation tactics that could cause people to be very at risk. There's suicide by cop. There's excited delirium. That was the name I was thinking. So there's excited delirium. And many of the times, these are things that our first responders are not quite, as familiar with. And so through trainings, we really say, okay, this is what suicide by cop looks like. This is what excited delirium looks like. This is how you can protect yourself when you're on the field and when someone is approaching you with a concern that maybe we aren't as familiar with. So then we're increasing connections to effective and timely mental health services for people in mental health crisis. This is where we can really serve as a liaison. And this is where we can say, okay, we initially have this person going through a crisis, and then now we can shuffle them along to the next step to really see through the help that they need. Use law enforcement strategically during crisis situations and increase the role of mental health professionals, peer support specialists, and other community support. This point lends itself all the way back to really the competency model. Right? This is where we are going to create a robust system that supports one another, that supports itself, that really has a common goal and has common language to work toward to achieve the public health standard of allowing people with a mental health concern to live a life of higher quality. All right, and then reduce the trauma that people experience during a mental health crisis and thus contribute to their long-term recovery. As mentioned, when we went over our NAMI Connects program, the one in the hospital, a lot of the times, these experiences are deeply, deeply traumatic. I don't know that any of us here, we may have been in a situation where maybe the ambulance has had to come for 5150, or the police officers or the CAT team was called for a 5150. It's scary. It's traumatic. It is an experience that will be kind of etched onto the person for the rest of their recovery. And what we're trying to do is soften so to speak, soften the blow and make this transition of, okay, you're in crisis, now we're going to get you to care, a little bit more gentle, a little bit more well-informed, and a little bit more streamlined, so that the person themselves aren't being triggered, aren't being, their crisis experience isn't being heightened due to the added stress that anyone would feel during a situation like that. So those are the goals of CIT.
All right, and really we want to emphasize also that CIT goes beyond just the training, right? We have this idea that CIT can be considered almost like a five-pronged stool, and really the training ends up, or those who end up getting the training end up using that training and having it trickle down into our community, right? And so jumping right off the bat from the top, community collaboration. And that's us, we did mention earlier about our community collaborations, right? So we do have those partners with Western Youth Services. We do have those partners at Hogue and at Be Well. And it's just amazing to be able to really be in the community from the ground up, and be there to offer those trainings right at the get-go in all parts of the community. We also want to make sure that we have vibrant and accessible crisis systems, right? So having an accessible system for those who may be experiencing a mental health crisis is important, but also having those on the other side, whether they may be in dispatch or, emergency medical services, having them as being part of that accessible crisis system to really be able to help those in crisis or in an emergency is so important. We also want to make sure that we have up-to-date law enforcement training, right? As Aisha was mentioning in just a previous slide, we want to make sure that not only our clients and our community members are safe, but our police officers and our sheriffs and those who are putting their lives on the line, that they're safe too when they are out interacting with those who may be undergoing that mental health crisis, right? We want to make sure that we have family members, consumers, and advocates all collaborate and educated together in one unique opportunity through crisis intervention trainings. We have so many people from all over the community come into those trainings, and really they just have the most amazing comments and unique insights that we can continue to use and even put into our trainings. We do have public CIT trainings as well, and I've heard countless times where someone says that they never would have considered something like excited delirium, right, as a possibility until they went through this crisis intervention training. And it really gives them an insight into not only what it's like to live with a mental illness or go through a mental health crisis, but maybe even how to correctly respond or know when to let law enforcement or EMS services jump in, things like that. So. And then also behavioral health staff training, and that goes, for staff, here at the Be Well facility or at Hogue, or even our own staff at NAMI and Western Youth Services, where, maybe where we didn't have some specific knowledge before, crisis intervention training does give us, de-escalation tactics, staff wellness best practices, things to really not only help our staff, but help them when they do have those interactions with someone who may be going through a crisis, right? Or be able to help our staff recognize when, someone may be on the verge of needing crisis intervention.
All right, and so this is where we've touched on it quite a lot, but really we want to drive home that creating community partnerships is huge, and so we've done that with Western Youth Services, and what this could look like in all of your practices is maybe connecting with law enforcement, maybe connecting with nonprofit agencies, creating a pipeline from your practice to resources within your county, create those community partnerships that really will strengthen and embolden one another to reach a common goal. And with those pipelines, what we do is we create a system of care for people who feel more supported. When we're referring to the system, we're all actively a member of that system. And so for those who are within that system, for those of our patients, for those of our clients, for those community members that really experience a mental health concern, we can make that process a lot more streamlined for them. So with us, what we've decided to do, and with Western Youth Services, we've kind of created a structured curricula that covers de-escalation, mental health training, and staff wellness best practices. And that last piece, actually, you would be surprised to hear, the self-care component of our trainings are actually the kind of the most fun, right? Maybe that makes sense, but really we get a lot of very positive feedback. A lot of the times, those of us in this field, first responders and mental health professionals alike, we are so focused on caring for another person. We're so focused on putting our energy out and caring for others that sometimes what we forget to do is direct that same energy inward. And we get to, in these classes, lead by example. And we get to feel, okay, you know what? I'm important too. My self-care is important too. Maybe I have experienced vicarious trauma. Maybe I am experiencing compassion fatigue. All of this is okay. And our classes serve as a safe space to really talk about that, and talk through those things. And then at the close of our trainings, really our ultimate goal is to allow people not only to feel a little bit just more, a little bit more confident in their ability to communicate with a person experiencing a mental health crisis, but feel a little bit more confident that they know that they can take care of themselves, and that's supported. So we have quite a few trainings, and I think we're about to just dive on deep into them.
Yes, we are. So we do offer quite a few trainings, and it's kind of amazing because, like Aisha mentioned a couple of slides ago, we really began this partnership with Western Youth Services just last year. And so, currently we're offering CIT for dispatch, CIT for corrections, and then CIT for youth and adolescents as well. And these are ones that have been approved by the county already, and they can range anywhere from 15 to about 30 hours. We've also got, on the back burner, we've got, crisis intervention training for fire, EMS, and law enforcement as well. And those are going to be kind of heavy ones, as well as they're going to be up to about 40 hours of crisis intervention training, which is amazing because, you hear, that some police departments and some fire EMS departments only in their initial training practices offer about 8 hours of mental health and crisis intervention training. And so we do think that, this kind of training, which is specifically targeted to anyone who may interact with someone experiencing a mental health crisis, is important, right? So that we do cover that, those basic mental health training, de-escalation tactics, and so many other points in our curriculum to really try and get as much information as we can packed into those 40 hours to enable those first responders when they are out in the field with the knowledge that they need when interacting with those in a mental health crisis. We also offer mental health first aid. Mental health first aid teaches participants how to identify, understand, and respond to signs of mental illnesses and substance use disorders, and respond in a way where it's, if they have the opportunity to respond themselves, but also emphasizing, that if needed, it's always so important to maintain your own safety and get law enforcement or those first responders involved. It is about an 8-hour class, and it is open to community members, in which they receive skills that they need to reach out and provide sort of that initial support and those initial resources to those individuals who may be in need of support, while also giving them the tools to show them how to connect those in crisis to appropriate persons of care, right? So whether that's, connecting them to 211 or, getting them involved in resources here at the Be Well facility or at Hoag, whatever it might be, but just giving them those points of knowledge so that they can correctly direct those who are in need.
Absolutely. And so two points that I like to make about the previous slide actually is that crisis intervention training, our package, is currently being approved or in the process of approval from POST. And POST is an agency which, once we're POST certified, would allow us to provide continuing education units to all first responders. And so who doesn't love a good continuing education unit and at no cost? I mean, that's amazing. So that's going on. And then mental health first aid. Anyone who graduates that course, typically you will find mental health first aid courses also being charged. We again offer it for free, no cost. And at the end of it, you get a great certificate that says that you are officially mental health first aid trained. And that, that looks really good, just in general as a human. So, alrighty. And then so we have a few other offerings in our CIT package. We have Voices. And Voices is something that Shivani was already mentioning. And oh, I see that we have a question in the comments. So I'll get to questions just in a little bit. If you could save your questions for the end, we're going to leave a juicy amount of time to dive deep, and we're excited to answer any questions you may have. So for Voices, what this is an hour-long presentation that gives first responders the opportunity to hear directly from a person, similar to this format, right? Just as Shivani and I are speaking to you, a person with a mental health condition is sharing their story to a bunch of first responders. And really what it does is it dispels common mental health condition myths, it answers questions, and then it's a great breeding ground for empathy, compassion, and understanding. Quite often we don't really understand how life with maybe schizophrenia feels. We don't offer how the manic episodes from a bipolar 1 episode feel. But in these cases, we get to hear about it. And it's really very informative, and it's a great opportunity. And then so we have provider education. And this is actually something that all of you here, I believe, would be able to take. So what this is just like we have CIT for first responders. This is for healthcare professionals and mental health professionals to just kind of come in and learn a little bit more about the lived experience piece. As professionals, all of us already know most, if not all, of the chemical processes that go into things. We understand that we understand treatment plans. So this does not get into that. This really just delivers that in-service training of lived experience, and then how we can best utilize the family to get the outcomes that we're looking for in our patients and in our clients. So Voices is a 1-hour training. Provider education is a 2-day training that spans 15 hours. So approximately 8 hours per day with a lunchtime.
All right, and we are finishing up here, but of course we always like to maintain some available resources that are for not just your clients, but also yourselves. We do have the OC Warm Line, which is powered by NAMI, available 24/7. And we also have, chat and text options for that number as well. The DD Hirsch Suicide Prevention Hotline is another big one for those of us in Southern California. We also have the OC Links. And these are just numbers that are available to you and to your clients. And then we are pretty much done here. So, for more information, you can always contact us or visit, NAMIOC.org. I am going to take this moment to just leave it on the screen for a bit, just so that if you want to write down the number, you can, or the website, you can. And while I leave it up here, I'm going to open it up and allow for any of you to ask us any questions, or we can answer the question that was already submitted in the chat.
Yeah, we'll start off with that, and then we'll just go, let me pull it up here. So how are recruiting peers for peer support? So this actually, it really depends on the program, and it depends on the specific level of peer support. So if we're looking at in the hospital, that's going to be a more traditional, we get a resume, we do the background check, we assure that the hospital's background check is up to par. We want to do all of that. If it is for face-to-face, then that's going to be a little bit different. If it's for peer connector, that's going to be a little bit different. And then also we always look for volunteers to share their story through our Voices program, through our lived experience panels. So if there is any interest in this crowd, or if we have any clients that have any interest, I really encourage you all to reach out. What I can do is in the chat right now, very quickly, I will drop my personal NAMI email. And then if you have any questions, if you have any interest yourself in taking a course, you can reach directly out to me and we can get that set up for you. So I'm going to go ahead and plop that on in. It's acon@namioc.org. There we go. All righty. So the long and short of it is, it's kind of varied, and it depends on which specific peer support avenue a person's wanting to take.
Okay, and I'm also putting in my email just in case. That way you have both of our contacts. And if one of us doesn't answer within the second, you can just email the other and bug the other person to do with any questions you might have. And yeah, I'm just running on a high right now because I did that Voices training last night, and so I'm just pulling pieces from that. But it was just such an amazing crowd, and even right afterwards, we ended up getting an email to to a couple different folks over at NAMI, and someone was interested in becoming a Voices speaker. She heard the stories, and she felt empowered to ask us that she would love to share her story and her experiences. And it's just so amazing, because it really isn't about what we do at NAMI, but it's about how the community rallies together to create this amazing space that gives people the opportunity to share their stories, and really gives people the opportunity to get rid of any stigma that they may have felt about their mental illness. And so it's just such an amazing program to really be a part of.
Absolutely. Do we have any other questions? Any thoughts, any comments, any grievances, any wishes, hopes, dreams?
Any self-care practices?
There you go.
I guess I'll share. I'm more familiar with NAMI San Diego, and I just think it's it's great how much you put in there into the community, because these kind of programs are they're so helpful, and it really helps with that space in between of like having somebody who's just not a professional, because there can be a lot of experiences that people experiencing mental health experience with professionals, right? So having someone that they feel like, okay, they can relate, they get me, it feels safer, right, to reach out to that. It's so amazing. So I just want to say thank you for these services you provide, because it's definitely needed and definitely helpful for the clients.
Well, thank you, and thank you for all that you do. I don't know exactly what your practice is, but I know that all of us here, we work really hard to achieve the same goal. So thank you as well. We all play a very important piece in this. Any other questions?
You guys
No?
are doing such incredible work, and it's so wonderful to see, like you said, how the community is responding. So we're really looking forward to continuing to collaborate, where we can. This was a really excellent presentation. Thank you so much for taking the time to put it together.
Yeah, well, thank you all for inviting us. And if you have any questions, absolutely feel free to reach out to either Shivani or myself, or you can include us on a group chat email, and it'll be a party in there. But we're definitely looking to establish a network within Orange County of providers, of practitioners, of healthcare professionals. And so if you're interested in getting involved in any way, or if you have any patients or clients of yours that you think could benefit from any of the services, feel free to pass them off. We will absolutely take care. And we're going to encourage you all to take care of yourself too. The weekend's coming up, and we want you all to practice some good self-care, get some rest, get your 8 hours in. We all need it. It's mental health month, right? So it's been a doozy. It's been a doozy for all of us. So
It's been a long month. Yeah.